Welcome back. You're watching KTN News Desk. Many thanks for staying with us. We are still on the issue of the importation of Cuban doctors who are expected into the country next week on Thursday amid refusal or displeasure, great displeasure from the local stakeholders, specifically the local doctors in the country. I want us now to take a look at who are these doctors who are coming, what are their kind of specialities, and what will you be treated to once they get into the country after, of course, or next week on Thursday, which is the day they are expected into the country. Let's just take a look at what some of their specialities are to just understand why the government took up this decision. So, of course, we'll be having 53 family physicians, 9 ICU physicians, 5 general surgeons, 5 orthopedic surgeons, 5 nephrologists who will be dealing with the matters of kidney issues, 3 radiologists, 3 nephrologists, 3 cardiologists, 3 plastic surgeons, 3 urologists, of course, dealing with the urinary system, 2 anesthesiologists, endocrinologists, and of course 1 dermatologist. These are the specialists who will be coming into the country next week on Thursday. 100 of them from Cuba, and of course the rest of them 1 each from each of the specialities here. Let's now take a look at some of the kind of petitions that are in court trying to stop the Cuban doctors from coming into the country. Currently, Dr. Mercy Korir is also following up on a case of the Employment and Labor Relations Court seeking to stop the importation of these 100 doctors. So from the latest petition against the Cuban doctors' importation, the petitioner specifically is objecting to the Cuban doctors and all the other foreign medical practitioners being issued with licenses and work permit by the third respondent on misrepresentation of facts that there exist no doctors in Kenya that can fill in the positions now being allocated by the Cuban doctors. That is the reason that this particular petitioner is giving the court that there was misrepresentation of facts by the government, especially when it comes to do with the capacity or the capability of the local doctors to run their business, especially in the healthcare system in the country. And as I continue to quote this particular petition verbatim, he says that unless this honorable court restrains the respondents by issuing prayers 1, 2, 3 of the accompanying notice of motion, they're likely to issue practice licenses to the Cuban doctors either on the 31st of May 2018 or soon thereafter, to the detriment of the medical stakeholder practitioners in Kenya. The petitioner arguing that this move is going to greatly or largely affect the healthcare system in the country, especially when it comes to improvement of the medical doctors in the country as per their personal and career growth. And he says that this is also likely to be used as precedent for the future application by other foreign doctors to the detriment of local doctors, where the government, precedents will be set for the government to keep bringing in foreigners to work in the country, do work which, in their argument, local doctors can easily do across the 47 counties in the country. Well, let's now take a look at what are the guiding principles when it comes to importation of doctors. Especially, we will be looking at what it is like in the Public Service Board in the country. What are the guidelines that that are associated with this kind of move from the government and, of course, from the international sphere as well. So freedom for physicians to migrate as international exchange aids development of medicine. The physicians must demonstrate same level of knowledge and skills as the domestic physicians, and of course this is according to the World Medical Association. Some of the guiding principles for importing a foreigner to work in the country: they should be individually verified. They should also, the migrating physicians should also have sufficient proficiency of the language of their patients. Like if they're coming to Kenya, they should be able to speak either in English or Swahili. The physicians who migrate should be paid the same as domestic physicians at the same level or rank. And of course, this has brought a lot of problems, especially with the local doctors who say that they will be paid way less than what the foreigners who are coming into the country will be paid. And of course, another of the international guiding principles says all exchanges and migrations should be voluntary and not forced. Those are the guiding principles from the World Medical Association with regard to the importation of doctors. We'll later on be taking a look at what are some of the local principles from the Public Service Board as per importation of foreigners to come and work in